Tracing the genetic roots of osteogenesis imperfecta.
I think it's very important to understand that there is some manifestation of this condition most often in either parent, both parents, or maybe even occasionally a couple of generations higher up, especially if both parents happen to be carriers. Now, having said that, not everybody remembers their childhood. So it's always a good idea to uh, keep this on a repetitive questionnaire kind of thing, where uh, when the child comes back with repetitive fractures or more than one fractures, or when we see on the x-rays that there is one fracture that's happened today and there is another fracture which has healed recently, which we can see on the x-rays, then generally speaking this question starts coming up, anybody in your family who's had this sort of problem in the past? uh, have you heard of this problem called osteogenesis imperfecta? Did anybody in your family have this tendency to break bones very easily? Was anybody treated for this? I think these are history based questions which are, at least in today's world, still valid. I'm sure in a few years down the road, I'm sure there'll be a blood test that will come about where or maybe you never know, maybe it's just a swab from the mouth, where we look at the genes and then we say, okay, you know what, this child has got osteogenesis imperfecta.